Alright, in this video we're going to go over things in just a little more detail. And as you sort of look through this, you'll notice that what there is basically a giant filter going on. And what you're going to do is the patient essentially passes through a series of gates. And if they pass through the first gate, that means that the first criteria has been met and the patient's not in any danger. But if they don't pass through the first gate, well, then they've got a concern. We'll do that in a second gate and then a third gate. And the third gate either leads to going home or, you would have guessed it, going to the cath lab. So when a patient presents with anything suspicious for cardiac, the patient should get an EKG. And when I mean suspicious, I mean anything on this giant continuum. So wildly suspicious would be like the 60-year-old male who has a previous history of an MI, a couple of stents in, and he has been having left-sided chest pain radiating down to his left arm exactly like his MI in the past, and his dead friends are coming to him in his dreams and telling him to run towards the light. That's not a miss. On the other hand, you have to have a high degree of suspicion for things that may be cardiac but don't present classically. So in this case, let's say this is a 40-year-old female who is having just a little bit of nausea and vomiting and generalized malaise. And you're not really suspicious, and she forgets to tell you that she's got a history of lupus. And that because of her history of lupus, her coronary arteries are just like this person's coronary arteries, but without the stent. So, large sort of distribution in regards to obvious over here, and not so obvious over here. Please keep in mind that in general, acute coronary syndromes tend to be underdiagnosed and undertreated in women. Alright, you've got a patient that comes in for anything suspicious of cardiac, and you get the EKG. So, get an EKG. Your indication for getting an EKG is anything that's cardiac, and a secondary indication is really even thinking about getting an EKG. It's sort of like the indication for intubating in the emergency department. The indication for intubating is thinking about intubating. Alright, so you're going to get your EKG. And the EKG is going to show one of two things. So the EKG is going to either not show a STEMI, or it's going to show a STEMI. Now, I'm sure everyone knows this, but just for those people that don't, STEMI stands for ST elevation myocardial infarction. So if this patient has a STEMI, you guessed it. The patient is, who would have guessed, go into the cath lab. So let's say the patient lucks out and they don't have a STEMI, well, then they go to the second gate. I'm going to clean this up so it's not so horrible looking. Okay, so the patient does not have a STEMI, so the next step is going to be to get 2 troponins 4 hours apart. Now, those troponins are going to come back one of two ways. Okay, either the first troponin is going to be negative, or the first troponin is going to be positive. So you can guess where this is going. If the first troponin is negative, then they go on to the next gate. If the first troponin is positive, they go to the cath lab. So if the first troponin is negative, you guessed it, they're going to get a second troponin at least 4 hours apart, and the second troponin is going to come back one of two ways. The second troponin is going to be negative, or the second troponin is going to be positive. If the second troponin is negative, the patient gets to go to the third gate. However, if the second troponin is positive, the patient goes to, you guessed it, goes to the cath lab. So if the patient's second troponin is negative and they're not going to the cath lab, they are going to get imaging. Talk about what kind of imaging later, but they're going to get imaging. If the imaging is negative, they totally luck out. Ooh, that's not good. If the imaging is negative, then they actually get to go home. However, if the imaging is positive, so the image is positive, the patient goes to the Cath lab. You're noticing this continuing overarching theme here. So think of this as there's an inquisitor at gate 1, gate 2, and gate 3. I'm going to beat this point to death to make the point over and over again. Then we're going to stop because we want to get this in under 8 minutes. So you're running through a series of gates, and at each gate there's an inquisitor. I don't care if you want to think of this inquisitor as a bouncer or a bad reference to Monty Python and the Holy Grail and None Shall Pass, but it comes down to this. You have to answer Inquisitor 1 correctly, Inquisitor 2 correctly, and Inquisitor 3 correctly to go home. If at any point in time you answer the Inquisitor incorrectly, got a positive STEMI, you answer the second Inquisitor incorrectly, either one of your troponins is positive, or you answer the third Inquisitor incorrectly, your imaging is positive, you are going to the safety of the Cath lab. That's all you need to know. As an overview, we're now going to go, in the next video, we're going to go into some details about what makes a STEMI, why we get troponins, and what kind of imaging we do. So I hope you've enjoyed this video, and the next one will be coming up.